keratoconus, which is hard enough to talk about and say, much less live with it. I went to several doctors, and I'd ask the same question: what can we do about this? They said, well, you wear hard contacts, and you wait until you have to have a cornea transplant. Your cornea will stretch out, it'll become like a cone, and you'll have to have it taken out, and the cornea will have to be put in. And I lived with this for years with the knowledge I was going to have to face a cornea transplant. So about 5 years ago, my vision really started getting bad. And the steeper my vision, my cornea got, the harder the contact was to put in my eye and to get a good fit. Well, the harder the contact fit, the more discomfort there is. And sometimes the cornea was so steep that it would just pop out because it was so hard to hold in. So I started looking on the internet because I thought something's got to be. There has to be something for keratoconus. Because, I mean, all these other diseases, why wouldn't they do something for keratoconus? So I found an article on Intacs lenses. And I was so excited, I went to my doctor and I showed it to him. And he said, yeah, this is a new surgery. And I said, yeah. He said, you know, I'm not going to be doing this anytime soon. And the more I talked to him, the more I realized that I'd probably have a cornea transplant before he started doing the technique. So I went back to the internet and I started digging just a little bit more. And suddenly Dr. Wang's name came up on lots of articles. And I started reading, and he's a world-renowned expert on keratoconus. And I didn't even know he was in the same town as me. You know, I'm so blessed. I was so excited. Then I thought, well, I probably won't be able to get into him. I got into him really fast. I mean, appointment, when I'm called, I had the appointment within a couple of weeks. I came in thinking that probably he was going to tell me I'm not a candidate. Well, he didn't tell me I wasn't a candidate. He said I was a candidate for these Intact lens. What the Intact lens does is they sit on the cornea and they hold it down. And I'll never be able to see completely out of it, but I won't ever have to have a cornea transplant, or hopefully I will never have to have a cornea transplant. And what I've always thought all these years is that the keratoconus was like a rope that tied me to a railroad track, and I could just lay there and wait for the cornea transplant train to get to me and run me over, because there's no other hope. So I began wishing for a miracle and wanting a hero. And Dr. Wang is my hero. Everything I read on the internet told me he had the technique, he had the knowledge, he had the equipment that is needed. You know, I wasn't going to bad doctors all these years. I went to good doctors. But what sets Dr. Wang apart from all those is his knowledge. He's not afraid to research new techniques, to come up with new techniques, and he's very successful in what he does. I had my Intacs put in on Friday. I feel great. It was a wonderful experience. I wasn't afraid. There was no pain. I'm looking forward to being able to now have a better quality of life, knowing that there's a possibility that I can be like this forever and never have to have a cornea transplant and all the things that go along with that. So I feel very blessed that I dug deep enough and didn't just accept what my doctor said, was that, you know, that's too far in the future, you can't do it. Because the future's here, and his name is Dr. Wang.
Thank you, Ms. Hunter. I think the take-home message is medical technology is very fast developing. When you have a medical